right. Welcome, everyone, to our webinar on overpayment, marketing abuses, care delays, and more top priorities for Medicare Advantage reform. For those who don't know me, my name is Aaron Plotke, a senior policy analyst here at Families USA. We want to thank everyone for joining us for this important discussion on Medicare Advantage and on the critical need for reform. And you can jump to the next slide, please. So for those who may not know us, we are Families USA. We are a leading national voice for healthcare consumers, dedicated to achieving high-quality, affordable healthcare and improved health for all. Next slide, please. So we have a very exciting program for you today. First, we will discuss the problems with the Medicare Advantage program, including talking through some of the major corporate abuses we're seeing in the program and how are they harming consumers and their families. We will also discuss a menu of promising solutions to reform the MA program to ensure it is actually delivering on its obligations to Medicare beneficiaries. Then second, we will then turn to my colleague Bailey Rivas, who will talk through the political opportunities for advancing and enacting pro-consumer Medicare Advantage reforms. And then lastly, we will then turn to our esteemed panel of advocates from Be a Hero, Center for Medicare Advocacy, and Medicare Rights Center, who have been leading the fight to take on the harmful abuses in MA plans and enact needed reforms. This panel will be moderated by our very own Sophia Tripoli, our Senior Director of Health Policy here at Families, and we'll discuss the state of the MA program, the panelists' work in fighting for needed reforms, and why we need to come together as health advocates against the entrenched interests of the MA industry and their corporate lobbyists. We can go to the next slide, please. So just by way of background, when the MA program was created as an alternative to traditional Medicare, it was often talked about as a way to save the Medicare program money and improve healthcare quality and outcomes relative to traditional Medicare. But as the MA program has grown over the years and now covers more than half of our nation's older adults and all Medicare beneficiaries, it has become very clear that the MA program has become financially unsustainable and is now a major driver of low-value healthcare spending in the Medicare program and in our healthcare system at large. Overall, it costs Medicare at least 22% more to provide healthcare coverage for patients enrolled in MA than if they were enrolled in traditional Medicare. And this has resulted in hundreds of billions of dollars in largely wasteful Medicare spending. And importantly, these overpayments are primarily driven by the corporate coding abuses of MA plans, where plans are fundamentally gaming the Medicare payment system to artificially make their enrollees appear sicker and more expensive in order to secure higher Medicare payments, despite the fact that those enrollees are actually tend to be healthier and less costly than those in traditional Medicare. MA plans have gone so far as to upcode and assign diagnoses through these sham chart reviews and health risk assessments that are not even medically supported and are very often not resulting in any additional medically necessary treatment or care. And this is having disastrous impacts on Medicare patients and the Medicare program at large. This wasteful spending is taking money directly out of the pockets of our nation's seniors in the form of higher Part B premiums, as well as out-of-state budgets and state Medicaid programs who help pay for Part B premiums. Due to these corporate coding abuses, Part B premiums were expected to increase a staggering $13 billion in 2024 alone. Even worse, these coding abuses are hurting Medicare's financial position and are contributing to its potential insolvency, which puts the entire program at risk and its beneficiaries. We've estimated that these MA overpayments and wasteful healthcare spending already make up nearly 10% of the dollars that leave the Medicare Trust Fund every year. Next slide, please. And what makes these coding abuses and overpayments particularly problematic is that for all the extra money we're paying these plans, they are not providing consistently better healthcare or healthcare quality than traditional Medicare. MA plans are not consistently providing better healthcare coordination or higher patient satisfaction or lower readmission rates compared to traditional Medicare. It is, in short, a national scandal that we pay MA plans so much but get so little in return. And due to a lack of meaningful transparency in the program, where even CMS doesn't have the data they need to oversee the program, we're largely flying blind to whether the MA program is truly delivering on its promises to Medicare patients. At the same time, however, what we do know is troubling. Beyond the coding abuses and the overpayments, MA plans are too often engaging in predatory and deceptive marketing schemes to prospective enrollees, where enrollees are too often, unbeknownst to them, being enrolled in an MA plan in the first place, or being promised benefits that are not even being offered by the particular plan that they're enrolled into. MA plans are also engaging in aggressive care denials and prior authorization restrictions that too often is not corresponding with what is actually legally required to be covered under traditional Medicare. And further, we know that MA plans are putting in place overly restrictive provider networks where too often plans are not providing the types of specialists and professionals that beneficiaries need for their health and healthcare. And lastly, we also know that MA plans are not showing up for our nation's most vulnerable beneficiaries. Because of these aggressive care denials and overly restrictive provider networks, it is the sickest and most marginalized beneficiaries that pay the price. It is no coincidence that it's those very beneficiaries that are least likely to enroll in an MA plan in the first place. And if they do happen to enroll, a larger proportion of them very often disenroll with only a couple of years. So suffice to say, there's a lot of problems with the MA program that need urgent attention, and we didn't even cover them all. But the bottom line is allowing these abuses to continue will continue to undermine our ability to hold this program accountable to delivering the high quality, affordable, and equitable care that we need. Next slide, please. There is good news, though, that there are a number of promising policy options that we can consider advocating for as a collective community in order to improve the MA program and ensure that it's consistently delivering on its obligations for Medicare beneficiaries and their families. Starting at the top, we can promote meaningful transparency across the program and ensure we actually have the high quality and complete encounter data that we need to ensure we understand, for instance, to what extent beneficiaries are even using their MA plans, the various benefits that are being offered, including supplemental benefits, and how often beneficiaries are subject to care denials and prior authorizations, among other key areas. We can also strengthen the MA payment system to prevent the industry gaming and corporate coding abuses, such as making meaningful changes to how CMS pays plans through its benchmark system and through its risk adjustment system. We can also strengthen the MA Quality Bonus program to ensure it's actually holding MA plans accountable to delivering the high quality care and coverage that we need and deserve. And we can do more to rein in the appropriate use of care denials and prior authorization requests to make sure they are actually in line with Medicare coverage rules. And lastly, we can ensure that vertically integrated plans who own providers of their own, are not inappropriately using those providers to drive Medicare overpayments further, and to make sure that they are not using our healthcare premiums to pad their profits instead of actually using those dollars to cover the delivery of the high quality care that patients need. And the last thing I'll say, the good news is if we are successful in reining in these overpayments, among reining in these other abuses, we can use those savings and reinvest them back into the entire Medicare program in the form of standard benefits like dental vision, a standard dental vision and hearing benefit, or an out-of-pocket max, or even a long-term care benefit, which every Medicare beneficiary can then enjoy. This would not only strengthen traditional Medicare, it would also be another important way we can hold MA plans accountable through the promotion of healthy competition and improved choice for our nation's beneficiaries. So with all of that, I will now turn to my colleague Bailey Rivas, who's going to talk through the political opportunities for advancing and enacting many of these pro-consumer reforms.
Thank you so much. We can go ahead. Perfect. Read my mind. Go to the next slide. For those who are not familiar, hi, my name's Bailey. I'm a senior manager of government relations here at Families USA. I think I've interacted with lots of folks through my work already on the traditional Medicare side through drug price reform and oral healthcare reform. So excited to be here with many of you talking about Medicare Advantage. So now that we have an understanding about these policy pieces that Aaron laid out, I think obviously it's important to kind of talk through where are there political opportunities to address this. Of all of the policy solutions that Aaron had mentioned, there are opportunities here either on the legislative or on the administrative side. So just kind of wanted to give folks an idea of the atmosphere that we'll be operating in towards the end of this year. And then obviously, importantly, starting in 2025 when we have a new presidential administration and new Congress. So starting quickly, looking at the new Congress, where we see opportunities in 2025. There's been a significant uptick in interest in Congress around these issues, around these, kind of buckets of policies. Importantly, we've seen a lot of bipartisan energy around many of these policy reforms. So, looking at, of the policy solutions that Aaron laid out, I think, they can kind of be bucketed into like there's a lot to address the transparency, to get an understanding of what's actually happening behind the scenes, to really address these upcoding abuses. And then finally, to kind of also address some of these prior authorization abuses that are being used to keep people from the care that they're being recommended by doctors. So I think looking forward to the next Congress, there has been a lot of proposed bipartisan bills in this Congress and bipartisan conversations around all three of these kind of buckets of policies. So rather than say that this is like the one that we know will happen, I think we know there's energy around all three of them. So it's going to be looking forward to the next Congress to kind of seeing where there's the most opportunity to get something done and being able to direct our energy there. I think it will be a little bit of flexibility, knowing that we'll be discussing and pushing all three of these areas, but kind of following based on who's the chair of a committee or who's introduced the bill that's like really getting a lot of energy with a lot of co-sponsors and really directing as a community towards and down that path. So obviously looking forward to what we can be doing this year to look ahead to 2025, as well as obviously this work will extend into 2025. It's really important to build co-sponsors and energy around the bills that already exist. For example, there's the Bipartisan No Upcode Act. There's a lot of other bipartisan bills. Like if you go to congress.gov, I think there's about like 80 Medicare Advantage related bills. So obviously there's a lot of energy. And I think it's taking the ones that we as a community feel are really important, building the co-sponsors, building the energy. So that way in a new Congress, there's already a lot of clarification about the policy solutions. Additionally, we know that there are some efforts in Congress now to kind of introduce marker legislation that really sets the more, ideal, comprehensive package of bringing all of these policy solutions into one place. It doesn't exist yet, but we know that there's a lot of energy between now and the end of the year to try and get something done there. So I think it's also as a community, working to build consensus on the reforms that go beyond the existing bipartisan reforms and like really create that marker comprehensive package. And then I'm actually going to get to the last piece in a minute after I talk about the administration stuff as well. So that's kind of where the opportunities are on the legislative side. Looking at the administrative side, either way, next year we are going to have a new administration. So looking at the two likely administrations that we'll have in 2025, I think if we have a Harris administration, we expect it to be pretty similar to the work that we've seen come out of the Biden-Harris administration. I think it's to be determined, always in a new administration, who the staff on the ground are going to be, who are the folks that are going to be working on this at CMS, at HHS. So pending that, but I think generally we expect their priorities to be similar. We know that they've made attempts through their annual rulemaking process with Medicare Advantage to kind of crack down on some of these coding abuses. We can always push them to go further. But we've seen interest in kind of addressing some of these abuses within the Medicare Advantage program. I think obviously with the Trump administration, it's more unpredictable. I think we are looking at a higher risk situation of undermining traditional Medicare and potentially pushing more folks into Medicare Advantage. But when we're looking at whether or not there's openness to kind of address these abuses, I think it's really unknown and uncertain. There wasn't a lot of indication from the last administration that this like is or is not a priority. So I think that means that there's a lot of opportunity for us as advocates to kind of have conversations about the importance of addressing these abuses. Obviously, it's an administration that is also vulnerable to industry voices. So I think that's an important consideration. So this year, when we're thinking about how to put ourselves in a strong position for the new administration in January, it's really important to get these as key priorities in front of the next administration. Most importantly, at the end of the year after the election, they'll have their transition team that really starts to develop those, particularly around their like first 100 days. So I think being united and strong as a community to kind of get in front of key transition team members, and potentially, if there are already sitting members at HHS, at CMS who are likely to stay, getting in front of those staff as well to kind of amplify this as a priority for them. But overall, coming back to that foundation for a counterweight, I think overall our most important political opportunity this year is to start to build that clear counterweight to industry. The Biden administration 2 years ago, in many ways, didn't go as far as they wanted to from a proposed rule to a final rule because there was such strong industry pushback and there wasn't enough of a clear voice from the consumer and outside of consumer, community to support what they were doing. So I think, you know, as as we've seen, industry is often co-opting the narrative of the people who rely on Medicare by claiming this is a cut or trying to make it seem that it's harming the people in Medicare Advantage for them to be held accountable for these abuses, which we know it's actually the opposite. It's better for the folks in Medicare Advantage. It's better for the folks in the Medicare in traditional Medicare for them to be held accountable. So I think it's really important for us as a community to like be building the real picture and making clear what is happening, who's benefiting. Um, and what's happening in the Medicare program and make sure that we're providing the full view to policymakers, both at the legislative and administrative level. So I think that's where we're looking this year. And then these are kind of the places that we can go to next year. And I believe with that, I am passing it over to Sophia to really have a more robust conversation about all of these with folks who have been doing this uh, for a while. Thank you so much.
Awesome. Thank you so much, Bailey. And thank you so much, Aaron. Really appreciate that. Good afternoon, everybody. Thank you so much for joining us. My name is Sophia Tripoli. I'm the Senior Director of Health Policy here at Families USA, and really excited to introduce our panelists and have a more in-depth conversation with some real experts who've been on the front lines of the Medicare Advantage reform movement for quite some time. So let me introduce some folks who probably need no introduction. But first, I want to introduce Jamila Headley, who's the co-executive director of Be a Hero. We have David Lipschutz, who's the co-director of law and policy and an attorney at the Center for Medicare Advocacy. And we have Julie Carter, who's the senior federal policy associate at the Medicare Rights Center. So welcome to the three of you guys. Thank you so much for joining us. And I think just to get us kicked into our first question, it would be great to just hear from each of you. Obviously, we've heard sort of Aaron and Bailey kind of laid out a little bit of what we see as sort of the policy context, the political sort of context and opportunities looking forward. But wonder to just hear a little bit from each of you to get us started. How did we get here? How did we get to this place on the Medicare Advantage side where it's got more than 50% of beneficiaries in it? It's got this crazy machine generating these billions of dollars of overpayments every year. And yet for all that we're spending, we've got these stories after story and data after data point just showing that the program is in many ways not meeting the needs of older Americans in the way that it was designed to do. So curious, maybe David, I think you look like you might be off mute, so maybe I'll come to you first, but I'd love to just hear a little bit from everybody.
For the record, I'm always off mute. But thank you for inviting all of us to the webinar today. How did we get here? I think it starts with philosophy. I think there's a fundamental difference of opinion and thought by different groups of people as to what actor or entity is best suited to provide people with health care. And there are those that think that the private market is the best actor to do that. And there are those that think that the government is the best actor to do that. And when the Medicare Modernization Act of 2003 was passed, that created the Part D prescription drug benefit that's only available through private plans, the private market won out because at the same time, it significantly increased payment to Medicare Advantage plans in an effort to have more plan sponsors come out of the woodworks to offer them. Those same folks that think that the private market is best suited to provide health care also are generally in favor of less oversight, less regulation. And so plans have been able to operate more freely than others perhaps might want them to be. We have an insurance industry that is a vested interest in maintaining their profits. And the more of a share of Medicare that they get, the more powerful they become, and the more they're able to influence policymakers. There are a number of factors that push people towards Medicare Advantage. People who are relatively healthy don't, have as many problems as people who are not healthy. And then, really, I think the fear of the unknown is also something that pushes people towards Medicare Advantage. I think all of us on this call who have some type of health insurance are very likely in some type of managed care plan. Traditional Medicare is this anomaly. It's this strange beast that people don't understand, and they don't realize that it's something worth protecting. So I think people go with the devil they know rather than the devil that they don't know.
Thank you so much, David, and lots to follow up on that, but we'll circle back around. Jamila, I wonder if you wanted to go next.
Yeah, maybe David, I'm much less polite than you are, because I have a two-word answer to that question to start with, and that's corporate greed. We got here because of greed. I mean, that is the bottom line. This desire by private industry and by private corporations, private insurers, to make as much money as they can off the backs of patients and taxpayers. They saw a golden opportunity in Medicare Advantage, and they have spent lots of money propelling the same philosophies that David outlined, right? Like among decision makers, so that the status quo remains and that they could continue squeezing as much wealth out of the system. The truth is, our decision makers, public officials, are using taxpayer dollars against our interests in this program, and really serving the interests of the private corporations. The other piece, as David mentioned, and this is related to greed. I mean, we've set up a program. When you hear how it's all set up, when you hear the setup, it sounds wild to me. Like, it's like, how could we have thought this would be okay? But we set up a program which is subsidized to the tune of billions of dollars by taxpayers over traditional Medicare, is given more funding, right? Like says it offers more benefits, offers hearing and dental, which traditional Medicare doesn't. As David said, offers a traditional, like, it is on the surface at first for many people cheaper than traditional Medicare. And we give people a choice when they are turning 65, or, many people are doing okay. And at that point, and we ask people to choose, and we ask people who don't make a lot of money and can't afford even, a supplemental plan that would allow them to afford traditional Medicare. And we ask them to choose. And of course, this is a choice people make. Millions and millions of people end up in a plan that really is serving the interests of the corporations, of the insurance companies, than it is serving their own interests. And the travesty here is like that many of these people are disproportionately Black and brown people, disproportionately poor people, disproportionately people in rural areas who need healthcare, good healthcare that they can rely on most. It is like the biggest scandal. The third piece of how we got here, I take a little blame as a healthcare activist myself, as a healthcare advocate. So many of us have been focused on fighting for the thing that we want, universal healthcare. Many of us worked on the ACA, and many of us have worked on other plans like Medicare for All and other efforts to guarantee people more healthcare. For many years, I didn't even know the extent to which private corporations were beginning to take over the Medicare program, which is the program on which we've modeled so much of what we want in the future for those of us who are thinking about what a future of guaranteed healthcare looks like in this country. And I feel like it happened on our watch. It happened while we were doing work. And so the other thing is, like, we weren't paying attention to the massive operation that was happening below the surface by corporations to take over our beloved and treasured public program. And we're now at a place where many of us now see it, and we have a responsibility to change that for the future.
Oh man, powerful words, and so
Mhm.
much to follow up with you on that too. And I want to bring Julie, you get come into the conversation and add in here too. And then I want to circle back on a couple of themes that you guys are bringing up.
Sure, and thank you. I don't know if I can say much more about the specific themes that Jamila and David pointed out, but I just will kind of return to this idea about this idea that private companies are better at doing things than government. I mean, this is really kind of one of the foundational principles. And I think that if we look at the history of Medicare Advantage, it's had a lot of different names, it's had a lot of different iterations, but it has never been cheaper. It has always done favorable selection. It's always managed to kind of pull out the people who are the cheapest. Currently, they pull out those cheap people, and then they say that they're actually more expensive. So they manage to get us both ways. But I think it's really important, and this is something that Jamila was zeroed in on, and I think this is super important. The Medicare program is behind the times with its benefits. It doesn't
Mhm.
have caps on coverage or caps on costs. It has caps on coverage, but it doesn't have caps on costs. It doesn't have some of the benefits that people expect. So when people are coming in, they're looking at their options and they're saying, "Hey, wait, I need to have some certainty. I need to have a cost cap. I need to have dental." That's like the big one that draws people into Medicare Advantage. I need that. So where can I get it? And then they look around and then they see that it's Medicare Advantage. So we've got this kind of absurd system where we're saying we're not going to give people the right benefits through Medicare. We're going to give people the option potentially to get some of these benefits through this weird shell game and only at the discretion of corporations that may or may not be providing those benefits. So we're just kind of paying extra in order to let people play a game of roulette with whether they get the benefits that they need. And I think that that's kind of one of the silliest and strangest things that we're dealing with here. Um, and then, obviously, if you're a policymaker, if you're in Congress, you're going to be hearing from people saying, "Hey, I need this coverage. I need this coverage. I need to keep my Medicare Advantage plan." And then they say, "Well, of course you do, because everybody can see the value of having dental." I will always use that as an example because that's what people, are often really focused on. And so I wish that people then would look at that and say, "Hey, wait, how about the people who don't have dental? Maybe we should do more to make sure that they have dental." But the people are not going to be wanting to take those benefits away from folks because that harms them, because lack of these benefits does harm people. So we really need to be looking at ways to extend this coverage, to extend these benefits to people in original Medicare, to make sure that they have the coverage that they need, because that's why they're choosing Medicare Advantage.
Yeah, and I think what you guys are picking up on is such this tension, right? Which is like the Medicare, the program, Medicare Advantage program. It's like in so many ways the cat is out of the bag, right? It's like over 50% of enrollees are now in MA. We have this incredible corporatization of healthcare that's occurring across many different sectors in the healthcare system. We also have a bit of an awakening, I think, that's happening in certain parts of the healthcare system around this corporate healthcare greed. And we're seeing it in the Medicare program is one of the places, obviously, with Medicare drug negotiation and prescription drugs and trying to lower drug costs for older Americans. We're seeing this in other ways in terms of protections for smashed medical bills and the proliferation of these big corporate entities that are increasing prices. And there is this sort of awakening of trying to understand the role of corporate entities in the healthcare system. And in MA, like there's this tension, right, between, and I think, David, it comes to your point about philosophy, which is, what is, how do we grapple with this solution? We've got more than half of the enrollees in MA, and we have these weird trade-offs that we have to make between the program. And so I'm curious, just any this for any of you guys, your perspective, and I think this is a bit of a philosophy question, but as we're talking to a group of advocates and thinking about the policy opportunities, I think it'd be interesting to hear from you guys sort of what is the philosophical solution to this, right? We've got policy approaches that can that can make the program work, right? We can put guardrails up, we can increase transparency, sort of a lot of the policy solutions that Aaron walked at up the top. And there's other folks in different philosophical places in terms of what who should be delivering our healthcare. And I do think this is one of the questions that policymakers are grappling with, and curious if anyone, wants to take that one and just offer a perspective on, what does that look like and how do we think about policy solutions in that context?
I'll take a stab at it. I think, along the lines of the whole debate about who's a better actor to provide healthcare, the private market or the government, I think highlighting the corporatization of healthcare, just as you've done, Sophia, and walking through how it's permeates everything. I think it's also helpful to think about the goals of the people that are providing healthcare, the entities that are providing healthcare now. One of the statements that infuriates me when people talk about universal health coverage and the people who are against it saying, I don't want a government bureaucrat getting in between me and my doctor. Well, who the hell is getting in between you and your doctor right now? It's an insurance bureaucrat who's not looking out for you. He's looking out for the company's shareholders. I think reframing things in a way to show just how, to Jamila's point earlier, about just how profit driven the entire industry is. And the quote savings that Medicare Advantage plans achieve, that doesn't get reinvested back into the Medicare program. That goes into the coffers of the insurance company. They tout how efficient they are, how much they're able to generate in savings by providing less care. That's because they provide less care, including care that's medically necessary. So I think continuing to highlight who is running the healthcare, who do we want in charge of decision making, what their motives are, and what outcomes that we want are critical to moving the needle in any of this.
Any other thoughts?
I'm sorry, Jamila, did you want to go?
Go for it, Julie.
Okay. I was just going to say, I think that, kind of what David was just pointing to is who's making the decisions. And I think one of the things like at the kind of policymaker or lawmaker level is just to say, you have more control over what's going on in the government than you do of what's going on at United. If you think that you understand Medicare and understand healthcare and want to have a voice, you're going to be more effective in what you're doing if you're trying to talk to people at CMS than if you're trying to talk to people who are running an insurance company. And I think that sort of, I think that it really is they're just kind of pushing off those decisions onto these private entities and then just kind of saying, oh well, we don't know. But that is a frustrating sort of they're washing their hands of it, and it is very frustrating.
Jamila, anything you want to add?
Yeah, I would say mostly, I think you're right that there is a philosophical tension, but I think that there is this awakening, and you spoke to an awakening happening, and it's not just happening among advocates, but it's happening among other people. When, over the last couple of years, we and other organizations that we partner with have done some polling. And when you poll folks, like folks don't want their health insurance company owning the doctor who takes care of them. Folks do want to see an out-of-pocket cap to traditional Medicare, and do want to see us strengthen that benefit so that people can really make a real choice between the two. So I think that there's a ton of opportunities. Like, people are really concerned about corporate overreach in healthcare and the implications for patients, and people are living the reality of the implications of that system that we have chosen every day, and they don't love it. Like, that is the truth. They don't love it. They're not happy with it. People don't know what the alternative looks like, feels like, should be, and it's our job to both help paint that picture and then work with folks together to fight for it. But I think, like, people have their finger on the pulse. Regular people, like, all over this country, have their finger on the pulse on what's wrong with healthcare, and have a sense that where we're at is not okay. in their lives and more generally.
That's the perfect segue, Jamila, to maybe I'll just come back to you again, if that's okay, to start us off. But you guys all, each of you in your organizations have been on the front lines of these issues and work directly with people that rely on Medicare for health coverage. You're often hearing stories and engaging with consumers directly and hearing their experiences. I mean, we've talked sort of like system at the system level, you know, what are some of the policies and the implications for consumers? But I wonder if you could just share a little bit of what are you hearing from patients? What are you hearing from their families in terms of how they're experiencing the coverage they're getting and the care they're getting through the Medicare Advantage program? We can put a little bit more of a human face on what this looks like for folks.
Yeah, over the last year and a half, we have constantly asked folks to share their stories with us if they or a loved one are a Medicare Advantage plan. So we've collected thousands of anecdotes and some more in-depth stories from people. One of the things that stands out to me as like a trend in many of the stories, and David, I know you can talk a lot more about this, is a pattern of denials in skilled nursing facility care. You know, when people need longer term care to help rehabilitate themselves after an illness or something, often not getting denied, and people being stuck between in this tough place between not being able to be safely at home and needing more in-depth care at a skilled nursing facility. That really stands out to me because one of the hazards of getting old is like getting sick, and getting sick to a point where your family cannot solely, or loved ones can't always on their own care for you. So many of us have older loved ones who've been through that. And so it's striking to me that that is just something that is routinely denied. We also hear a lot of stories of people whose doctors or hospitals, key hospital in the area that they live, like the one place they can go, pulling out of network for Medicare Advantage plans, because Medicare Advantage plans also reimburse. Not only do they get more money from the government, they reimburse providers less often and give patients less. So they're really eking out profit at all sides, and providers are beginning to get really upset about that and beginning to pull out of network. I was just driving yesterday and heard ad by the insurers. It was an ad by United Health, and it was here really lobbying, like calling on regular citizens to support my local hospital in my area not pulling out of their network because there's a big fight going on right now around coverage. And if people where I live lose access to that hospital, it's all sorts of care that isn't possible for them. So that feels like it's just another, we hear those kinds of stories that are heartbreaking. And then I think the third type of story that we hear over and over again, particularly from loved ones, but also from people themselves, is just how many hours they spend fighting the insurance company, fighting prior authorization, denials, delaying getting the care that they need for their loved ones, you know, really tearing their hair out trying to figure out how to get what they need, having to face whether or not, you know, they put care on credit cards while they fight it out with the insurance company. And it is already really hard to deal with someone who is ill or someone who is dying, but to have the primary draw on your time be fighting an insurance corporation, it's just the worst thing ever, and it's inhumane. And so, yeah, those are some of the stories we hear.
That's extremely helpful. And honestly, it's just heart-wrenching. And I think probably like everybody on the webinar can think on, you know, themselves or family member or somebody they know that has had those exact experiences. And I think that's one of the things that's so disturbing and also so powerful about this idea that we need to come together even more as a community and continue to grow, looking into opportunities next year, is that everybody has this. There's just the stories. There are so many stories of people falling through the cracks of the system, not getting the care they need at a price they can afford, and so it is an experience that unites many of us across the healthcare system and how we experience the healthcare, the way we get healthcare. Julie, David, anything you guys want to add in terms of stories And before we move on and talk about what we're doing to push back on some of these problems.
The other thing that I would flag, and against, in addition to Jamila's great list, just the difficulty of choosing a plan, just the difficulty of just figuring out which plan am I even supposed to be in. If you've decided that you really want Medicare Advantage, it is very, very difficult. A lot to do with the providers. Like it's very hard to figure out who's in network. Who are all of my providers in this network? Is this directory accurate? Who do I have to contact the provider each time? That sort of thing. Some of the networks are tiny, so maybe one of your providers is in this network, one of your providers is over here. So just trying to figure that out. And then the other thing, which I don't think we've touched on much, but is just once you kind of get in, it's a little bit hard to get back out. In a lot of states, it's very hard to come back out of Medicare Advantage because you don't have necessarily the ability to get a Medigap. You don't have necessarily the ability to pay for your out-of-pocket costs. So it can be a thing where people feel like they're trapped in once they make that decision. And those initial decisions are often they're not exactly random, but they're not necessarily like people really working through all of the options. It's just that they're seeing more about Medicare Advantage and they think, well, this is the one that this is the choice for me, and then they move into Medicare Advantage. And then once they run into problems, it might be too late for them to come back out in a lot of states.
Right. A lot of folks sort of experiencing those aggressive marketing tactics to convince folks to enroll in a plan and getting in there and realizing, oh, actually, this might not be the right plan for me. And what are my options in terms of getting out and getting the coverage I actually need to meet my health needs? So I wonder, and David, maybe I'll come to you to start us off, and please feel free to pick up on any threads you want to from in terms of consumer stories. So obviously, a lot of challenge, but I think like hope is not lost, right? Like I think there's a lot of important and good work that's happening in terms of being able to put some guardrails up and rein in some of the challenges and the abuses that we're seeing in the Medicare Advantage programs and consumer protections for older Americans and their families. I wonder, David, if you could get us kicked off, and then would love to just hear from each of you for a minute about some of the work that you guys have been doing and that you're leading in terms of taking on some of the abuses in the MA plans.
Sure.
And any lessons learned as you've been getting in there, any lessons learned that you think might be helpful for folks to hear?
Yeah, I think a lot of it starts with where you started, Sophia, is with a story collection, something that I know Families has been great at for years, including the Affordable Care Act and the fight to protect the Affordable Care Act, because that's one of the first things that journalists ask for. Well, show me the body. So
Right.
if you have someone who's particularly affected that's willing to talk with the journalist, that's going to go so much farther than some nerd such as myself spouting off about a particular policy issue. So it's the stories, it's helping people tell their stories, and it's paying attention to the minutia and the big picture. You look at the big picture, you try to advocate for significant change in legislation, but you also have to pay attention to the details. You have to participate in the whole regulatory process, the public notice and comment. You have to weigh in when you can to try to change things as it moves incrementally while you're still pushing for big picture change. I think, and I just want to give kudos to Jamila and Be a Hero. They've been outstanding at raising awareness, public action, public engagement, and things. I'll let her talk about all that. But from where we sit, it's also been really useful to kind of work with strange bedfellows. There are different actors or stakeholders in the whole healthcare ecosystem that you're not always on the same side as. And when it comes to Medicare Advantage plans, a lot of provider groups and provider associations have had it with the prior authorization. The same burdens that Jamila walked through, providers have to deal with when it comes to prior authorization, as well as the lower pay. So in the last few years, we've seen a significant shift in providers' willingness to speak out about the problems that they're encountering in Medicare Advantage. And we're able to combine forces and be on the same page with some groups that you usually don't work with, even if you're diametrically opposed on some other issues. I think that goes a long way, and it gets the attention of policymakers in a way that just screaming into the void on your own isn't going to help all that much. And working in coalition. I mean, we've worked for years with Julie and Medicare Rights Center, and I think it's more effective when we're all on the same page and we're advancing the same things. And more recently with Jamila and Be a Hero, and combining what typically, and forgive me, Julie, are kind of policy nerds as we are sitting behind our desks, combining with the kind of work that Be a Hero does in really mobilizing people, really moving people, and inspiring people to take action, educating them and giving them the tools they need to do things. It really has been a sea change over the last few years, a very welcome and long overdue one.
Yeah, it's such an important point. The 2 points, I think one is like thinking about the types of partners and the counterweight that we need to have as an advocacy community to those industry interests, to the insurance industry interest, to preserve the status quo, and the extent that you can be bringing in grass tops, grassroots, in other sectors, employers, labor, other groups that have power that can help, providers that might be aligned, that can help be the counterweight. And then absolutely, and maybe Julie, I'll come to you next just to talk a little bit about some of the grassroots work you've been leading for the last couple of years and how important that is to changing the conversation and engaging in and activating folks.
Yeah, David, thank you for pointing to us in our work. We have been deeply grateful to be partnering with Center for Medicare Advocacy and many other organizations on this work. I think what David said is absolutely right. We need people paying attention to the minutia, every rate change notice, every change that comes up from the administration. And we need also people trying to build power to shift the dynamic that we're currently in. So there's been a couple of things. One, we've been focused on trying to bring together a coalition that does cross the policy nerds and the grassroots organizers and the former CMS officials and many other folks just coming together as a little bit of a ragtag band group trying to figure out what we do on this. And that has been some of my most fun work over the last couple years have been with that group of people trying to figure out at every turn how we begin to raise awareness on this and how we begin to tackle this issue. So I think that work is important. I think the second thing is getting clear on solutions. One of the things that many of us are still really wrestling with is how do we fix this mess, right? And so I think there is still more work to do to really, not only, I think some of us feel convinced of a few things, that we need an out-of-pocket cap to traditional Medicare, that we need to add dental, vision, and hearing to traditional Medicare, that we need to make it a real choice. But the mechanics of how that would work, how we would pay for it, where we can rein in payments, that work is really critical work that needs to be done at this stage so that we have something to really push for when we have the window of opportunity to really get some massive change. And we're not waiting for that moment to duke it out or ending up with another tweak that actually serves the interest more of the insurers than it does of patients. But the biggest thing that I've learned over the last few years is there's been lots of people at the table on this issue and very few patients at the table on this issue. And there are so many people suffering. And I feel like the thing that has been clearest to us is that we are up against so much with the insurance corporations. I think as Erin, you mentioned in your presentation, when the government proposed a rate reduction to, for the first time under the Biden administration last year, they took out a Super Bowl ad, that more than $7 million on a Super Bowl ad. I remember watching the Super Bowl. I was actually sitting next to Adi, my co-director at the time, and we were just shocked, right? Took out a Super Bowl ad. This is the amount of money, power that they have to influence, and that's indicative of the power that they have to influence decision makers, to influence people, members of Congress, to influence the White House, and they use it all unashamedly. I'm really clear that we're not, those of us on this call can't come up against that kind of power and win. We actually need a much bigger army in order to win that. And I think that is going to come from patients. That's going to come from people on Medicare, people who are becoming eligible for Medicare, and their families who really want to fight to change this. And so our focus has been really there. How do we start to engage and to activate folks who are really suffering at the hands of this really unjust and irrational system that we've set up.
Yeah, it's so beautifully said. And I think like that ad that, right, that came out during the Super Bowl, I think it got through, right? It broke through to a few political folks in the administration. They got nervous that there was going to be, you know, that the framing was cuts to Medicare. And they pulled back, right? And at the time, I think, you know, it was a good learning moment, I think, of like how important it is for the partners, for our organizations, the folks on the call, on the webinar, and others to be active and having our voices heard in those moments, so that the policymakers, the decision makers understand that actually the insurance plans don't speak on behalf of consumers, of people, of our nation's families. Actually, we collectively do. And to your point, that the voice of people is being heard and their experiences are being heard in the dialogue as well, because they are the ones who are being impacted the most. Julie, I want to go to you and see if there's anything to add, and then I want to make sure we get to a couple of Q&As that are coming in through the chat, and then I'm going to ask you guys as we're getting ready to wrap. So I'm going to prime you so you can be thinking now. I think two things. One, to be thinking about opportunities. Where you see opportunities, we look, you know, we've obviously got a big election coming up. So between now and you know, the first 100 days of next year, and then what is one thing that you want advocates to take away from the call? So I'll come back to you guys on those, but have your brains thinking. Julie, anything you want to add just in terms of opportunities and policy?
Yeah, I mean, and first of all, I feel attacked by the policy nerd conversation. But it's fair. It's fair. The only other thing I would add is that, you know, Medicare is ridiculously confusing, and everybody is ridiculously confused by it. And that goes from the highest levels of policymaking down to people who are trying to access the program. And so I think, in addition to all of the other things, and activating networks and getting everybody engaged is just some foundational education. And I think that all of our organizations can play a role when it comes to explaining not just the stories that people are you know, are having, but also what's causing it. What's the thing that's causing it in the design of Medicare? And I think that to a lot of people, they don't even know that dental and vision and hearing are not covered. They don't know that long-term care isn't covered. They don't, you know, there's a lot of things that they don't understand because Medicare is kind of a relic in a lot of ways. And so it's complex, and we need to do better at making sure that people understand how the program works and what can be done.
Perfect, and perfect segue. So let me get to a couple questions, and then I'll come back to you guys for your wrap up thoughts. A question coming in about if there are any efforts, if you guys know of any efforts to end the participation of Medicare Advantage plans from being part of Medicare. Anyone want to take that one?
Well, I think there are some policymakers that would like us to do away with Medicare Advantage plans altogether, and I don't think that's realistically on the short-term horizon. Although in recent years, looking at kind of universal healthcare bills or Medicare for all bills, there's been a lot of more thought put into what we want the program to look like. And actually, if I could just shortcut ahead to one takeaway message now
Please,
and say
go
it,
for it.
is that to answer the question, why should I care about any of this? Why should I be involved? Is because if you want universal health care in this country, ask yourself the question, what do you want it to look like? Do you want it to look like what we have now? I mean, my own health insurance plan, I don't even know if it's an HMO or a PPO, but I know I have one deductible that applies to me and another one deductible that applies to the family, and I can't keep it straight. And I've been doing this stuff for 20 something odd years. Is that what we want healthcare to look like? No. I think we have a much different vision of what we want healthcare to look like. There's a lot of opportunities coming up to push back. I think using the industry's words against them is a fantastic technique, because they wear their business hats sometimes and they wear their public relations hats at other times. take their business words that they share with their shareholders, like this year we're focusing on margins over membership, or we're exiting from unprofitable areas. Use that against them, because they, you know, when they talk in their business language, it is cold and callous, and that just highlight that as a means of trying to raise awareness of what it's all about at the end of the day.
Super helpful, David. And I think, yeah, I think politically challenging in this moment right now, given, you know, the divisiveness of national politics, to be thinking about pulling away with MA plans. But I think, to your point, I do think this is about, like, where do we want to go? And what guardrails and reforms we need to get in place right now so that we have a system that's ready to move into that universal vision that we all are fighting hard to make sure that we can get in our lifetime. Jamila, I'll come to you next, and then Julie, any thoughts about upcoming opportunities and one key takeaway for folks from today's webinar?
Yeah, just a note too on the question that you asked, David, about if there are efforts to kick Medicare Advantage plans out. One of the things that we suggested is that CMS really use its regulatory authority to really get rid of plans that are acting particularly badly, like who have incredibly high rates of denials, who there's very little there has so far been very little consequence for plans who are acting in this way. And so, you know, one solution would be kicking them, you know, forbidding the actual insurer of that plan from offering any Medicare Advantage plan if they have a rate of denial above a certain level. So these are some of the policy solutions that we've suggested to the White House and to members of Congress. But again, those are small fixes in a system that is much more perverse, actually, and that needs, I think, a bigger fix. So I'm going to go straight to my takeaway too, and David, you got a lot of it there. Like if I were to say, like, why should you care about this? Why should you work on this? Because I have actually become really convinced over the last year and a half, and I didn't start here. Like, I didn't start off knowing much about this issue at all, like 3 years ago, and now I've become really convinced that the future of healthcare in this country, the future that many of us want with healthcare, is at stake, and that this is standing really firmly standing in the way. Like, just to break down something that we haven't said yet on this call, and that I don't want to leave without saying and having people understand, is we talked about the overpayments, the billions of dollars that have gone, that have been scammed out of the Medicare Advantage system, and you know, we talked about the fact that there's up to 1.6 trillion that we can see that will go in overpayments between now and 2033. You know what they're doing with that money? Many of the corporations are using, this is their highest profit margin product. They're clear about that with shareholders for all of the insurers, right? And so they're using taxpayer dollars to then fund vertical integration, to buy up primary care providers, to buy pharmacy benefit managers, to buy up revenue management corporations, and so much more. And they're restructuring healthcare using this public money, using our taxpayer dollars. It is the biggest scandal, I think, right now. It's the biggest misappropriation of public funds that I know of. And we should all care about it, because not only is it a misappropriation, it's a misappropriation of the dollars that we hard-earned tax dollars and of our trust as taxpayers, but it's also something that is really changing the structure of healthcare in this country in a way that that really continues to put corporations first and patients last. And I don't think we can afford it long term. And all of us should be fighting to stop the kind of takeover. One other thing to mention is that in Project 2025 plan, they make it explicit. Their goal is to make default Medicare Advantage the default choice for anyone on Medicare. We simply cannot afford that. Our colleagues at PNHP did some analysis on this, and basically we would bankrupt the Medicare Trust Fund in less than a decade if we went that route. So everyone who's on the call, like there's something for you to do on this, whether it be talk to your loved ones as we're going into open enrollment and try to and not have them fall prey to a huge amount of advertising that will come their way to try to get them to switch on to a Medicare Advantage plan or to select that, or to divert your organizational resources and things into joining this fight with many of us who are in it already. You will not be alone, and this is deeply critical to everything that we care about for the future of healthcare here.
Beautifully said, Jamila. And Julie, I'm going to come to you. I know we're at time, and if the team, as we're going to Julie for the final word, could put up our final slide, which is how to stay involved, how to stay connected, in addition to making sure you can reach out to any of the speakers, myself. If you have a story, get in touch. There's some important rulemaking opportunities coming up, and so keep an eye out. And Julie, I'm going to kick it over to you to just give us the final word and your thoughts as we wrap up.
Sure. I would just say that we don't know exactly what's going to happen in the next few months, and so we all need to be as nimble as possible to try to take advantage of anything that might bubble up and that we might be able to leap on. But we should all also just have the idea that this is a long haul. This is going, just this total reform is going to take a lot. It's going to take a lot of bodies and a lot of elbow grease. So don't get discouraged. Policy is not for the weak of heart. So we need to get in there and make the changes that we can when we can, and also just keep up the good fight.
Thank you so much, you guys. Thank you, Julie, Jamila, David. Thank you so much for joining. Thank you so much to our attendees for joining. Please stay tuned. We'll be following up with more information and resources on how to stay involved. And I hope everybody has a good rest of the afternoon, and we'll see you in the fight.
Okay, thanks for having us. Thanks, guys.